Okay, so back again to the oro-antral fistula. This is a case where a patient came to a clinic. He wanted to extract this tooth due to a big carious cavity, as you can see in here. And before extraction, the flow of the sinus was continuous. There was no problem, similar to the sinus on this side. So when the extraction was done, the tooth broke, and there was a small piece, the apical 1/3, as you can see in here, of the tooth remained in the socket. The distal root, or the distal buccal root was removed, but a piece of the buccal root remained inside the socket. You can follow the flow of the sinus over here. You will see that the distal buccal root, the continuity of the flow of the sinus is no longer seen. So there was a discontinuity in this area, and still the flow of the sinus seems to be within normal over here. However, this piece of the root is still remaining in the inside the socket, the apical third of the root. The tip of the root was removed, okay, and as you can see here, that if we follow the flow of the sinus is continuous here, but in this area the flow of the sinus has lost its continuity. So it means that the communication between the sinus and the oral cavity actually was in the distal buccal root of this tooth. Of course, the treatment was done for the patient. This is oral surgery, for the oral surgeon to do or for the dentist to do. But what we want to see here is we want to see how it would look. Of course, this will also affected by the quality of the radiograph. Now, if you increase the density of the radiograph, you can still see the flow of the sinus over here continuous, but in this area there is a discontinuity in the distal buccal region, which means that the discontinuity of the flow of the sinus was in this area. Thank you very much.